Gentlemen, thank you for coming to the Community Health Talk put on by Nova Scotia Brotherhood in conjunction with the Men's Health League and the Black Women's Health Alliance. Today we have Korede, Akindoju, right?
Akindoju.
Oh my Lord, man. I'll just call you Korede. Anyway, he's a physiotherapist, and he's going to be talking about lower back conditions and the benefits of physical activity. I'll give you a little background on Korede. He was born in Nigeria, moved to Halifax at the age of 8. He grew up in Fairview, Clayton Park, went to Dalhousie University for his undergrad in a BSc in kinesiology, and graduated from a master's in physiotherapy in 2016. He currently works for Nova Scotia Health Authority, Community Health Team, and he offers free health and wellness programs. And he also works in private practice on the side, and lots of MSK conditions. So welcome, Korede. Thank you.
Thanks, Twain, for the introduction. So my name is Korede, physio, and today we're going to be talking about some lower back conditions and the benefits of physical activity. I'm hoping this will be under an hour, so I don't take too much of your evening. It's very beautiful outside. And if you guys have any questions along the way, please don't hesitate to put it in the chat box or just speak up or whatever. So let's just get started. Let me see. Okay. First thing I want to mention is that, yes, Dwayne mentioned that I work for the community health teams. So the community health teams offers free health and wellness programs around HRM in Halifax, Dartmouth, Shabukta, which is like Clayton Park, Spryfield area, and I'm missing one, Bedford, Sackville. So our free health and wellness programs are around nutrition, physical activity, mental health, and a whole host of other things. And then the other thing that we do is a thing called navigation. So if you're looking for resources with regards to your physical activity, nutrition, all that stuff, you can give us a call and someone will spend time and talk to you and try and navigate you to the right place. The reason why I have this slide up is because we are constantly looking for feedback from our communities and things like that. So if you go to Your Voice Matters on Google, you can fill out a survey and talk about what your health needs are, what things would you like to see in the community health team, and how would you like them to offer better health programs for you. Considering the times that we are now with systemic racism and systematic racism, one of the things, this is a great way to show some action for our African Nova Scotian communities, because as I'm the only Black guy in all of the CHT, and sometimes it's difficult because I don't really get to see a lot of African Nova Scotians, people of African descent, and the people that we serve. But if we get some feedback from these communities, then we can try as much as possible and create access for those communities as well. So I think that's really important. So if you have time, fill out that survey. So we'll get right to it. So just going to talk to you about physiotherapy, what it is. I picked a couple of conditions to talk about. We'll talk about some treatments and then benefits of physical activity. This is not going to be very specific or overly detailed. Maybe we'll see how this goes, and if people like it, we'll maybe break things down in a little bit further. But yeah, these are very, very general. And again, if you have any questions along the way, just let me know. Okay, so what's physiotherapy? So physiotherapy is a treatment method that helps people restore, maintain, and maximize their physical strength, function, and overall well-being. Typically, you would see, your generic physio is the guy that's in the clinic that helps you if you have a bum knee or bum shoulder and things like that. But physiotherapy incorporates a lot more things than that. So you'll see us not only in musculoskeletal practices or private clinics and things like that, but you'll see us working with people in the neurological population. So helping someone that's recovering from a stroke or spinal cord injury, in cardiorespiratory population. So deal with people that have COPD, deal with people that have suffered heart attacks. We deal with people with heart conditions and a whole host of other things. Pelvic health. So pelvic health is kind of exploded. Pelvic health physio has kind of exploded in the past decade and things like that. And then also like cancer and lymphedema. But again, the main focus of physio is really to just kind of restore, maintain, and maximize your physical strength and function so that you're able to do the things that you need to do. This is just kind of a discussion here. So you can either put it in the chat box. I'm not sure if I can see the chat box, but put it in the chat box or speak up. I just want to know like what your thoughts are on back pain. How have you experienced it? How has it affected your life? And have you done anything to make it help or whatever? So you can fill in the chat box or speak up. Let me know what your thoughts are with back pain. And if you have nothing to say, that's okay too.
Oh, you want us to put things in now?
No, just anybody just yell out anything. What are their thoughts on back pain? How have you experienced it? Things like that.
Yeah, low back pain for sure.
Yeah.
Definitely.
Okay.
I have lower and mid back pain.
Lower mid back pain. Okay. Loretta says she's had back pain associated with posture at the computer, poor ergonomic setups. Yeah. Okay. Anything else? Anybody else?
No, I'll tell about my mother. Korede, my mother's 94.
Yeah.
Having a lot of pain in her back and her left leg.
Mm-hmm.
Doctor diagnosed her with spinal stenosis. So
Yes.
we can talk about that a little bit too. That'd be good.
Okay, great. One of the conditions we'll talk about is spinal stenosis, and I'll take a little bit there. So Karen talks about shoulder pains. Can you speak up? Can you speak about shoulder pains and proper way to sleep? So with shoulder pains and sleeping, obviously if you're resting on the shoulder that hurts, it can kind of aggravate it. Some of the easiest remedy is to try and sleep on the other side, or changing your sleeping positions. If you have a number of pillows, you can probably go to a physio and they'll be able to kind of show you where to kind of sleep. I don't know if I can really show you that right now, but usually if you have like a pillow like so, let's say you have a left shoulder issue, if you have a pillow like so and you're laying down like this, then that typically helps and stuff like that. Another question about back pain associated with posture, computer, poor ergonomic setups. That's a really good question. So posture is one of many things that can kind of aggravate your back pain. So typically when we get into pain, there's kind of three things that happen. So one is sustained positioning. So if you're holding your positions for quite a long time, so if you're at work and you're sitting for prolonged periods, that can cause some back pain. The other thing that can get people into pain is when they do something or lift too much or lift over their loads or over their body's capacity. So let's say you pick up like a 100-pound box that you didn't think was 100 pounds or tried to lift it up. You can get pain from there. And then the other issue with pain is the sustained loads or repetitive loads. So let's say your job requires you to twist and bend all the time, or we're not shoveling anymore, but let's say you're gardening and you need to shovel out some stuff from the grass, and you're shoveling flexion and twisting, flexing and twisting, flexing and twisting. Over time, that can kind of aggravate your pain. And you're right, so having ergonomic setup is important, but really the big thing with office work and posture is to try and move often. So we know that like taking breaks is really important in helping alleviate some of that pain. Pain from working out. So yeah, you can certainly get pain from working out. A lot of the things that can happen are, one, how are you working out? How's your form when you're doing it? Are you new to exercise? Are you kind of experience. If you're new to exercise, sometimes you can lose your form. You can lift heavy weights. So there's a lot of things that you can incorporate or that kind of incorporate with pain and working out. And it's probably one of the good reasons to kind of see a physio, because they can kind of help you through that process. And then Janelle says lower bulge disc, chronic daily pain. So I'm going to talk about that in the slides later. Thank you for those thoughts and questions. I appreciate it. All right, so moving on. All right, I'm sorry if these illustrations are kind of blurry, but I'll just kind of do my best to explain some of this stuff. So we're talking about the lower back or your lumbar spine. So there's 5 vertebrae, and each vertebrae basically is the bony little piece right here, okay? And in between that, you have your intervertebral disc. And that is a kind of jelly, hold on. That is a gel thing that kind of helps with stabilization. It helps shock absorb, and it's a spacer. So in terms of spacers, this yellow stuff that's right here, these are your spinal nerves. And the intervertebral disc, these blue things, they kind of open up some space so that your spinal nerves can go through your spine and kind of control your movements and things like that. Again, your spine is meant to kind of support your body as you're doing things like walking, lifting things, your typical daily life. It's meant to support you. It's also meant to move. So movements of the core, whether you're bending forward, bending backwards, twisting left and right, your spine's meant to move. And your lumbar spinal nerves control the movements of your lower body. So again, your spinal cord kind of goes down through the spine, and then it kind of branches out into different spinal nerves, and they can control different parts of your body. So in the physio, sometimes if they're trying to find a region where maybe you have stenosis or you have a disc pain in a certain region, what they'll do is like a muscle test. So they'll get you to like kick your leg out and try and do it 5 times, or kick your leg out and hold it for a certain amount. And if you have weakness, it's an indication that you might have some sort of nerve issue. So that's basically what the lumbar spine looks like. Facet joints, those are just kind of like a bone ligament connection in your back. Okay. Yeah, if you have any questions, just lay it in the chat box and things like that. All right, so this is the first kind of condition that we're going to talk about, and this is called disc degenerative disease. It's strongly correlated with age. So what I mean by that is, as you age, your disc tend to get a little bit smaller and they degenerate. I don't like this term because, you know, it's everyone tends to have it. As you age, it's a normal process. It's a normal part of life. We get degenerative changes. What happens sometimes is that these degenerative changes can be really, really bad, and then it can start to affect your function. So you get severe back pain, you can get some nerve root irritations, and then doing simple tasks around your home can cause a lot of pain. So if you look at the bottom graph here, and I hope this arrow is showing, so this kind of looks like a healthy disc, or those spacers that are in between your vertebrae. As you get more degenerative, the space starts to go a little bit smaller until it's kind of bone on bone. So with that comes pain, and then also some irritation in the nerves. So again, with irritation in your nerves, you can have some motor deficits. So like you can have trouble controlling your lower body, and sensation can be kind of off too. So you can feel a lot of numbness and tingling and things like that. I have here that most intervertebral disc degenerations are asymptomatic. So what I mean by that is someone can be 70, 80 years old, but not show any signs of any degenerative changes. So there's someone that's asymptomatic. They don't have any pain. They're going about their normal life. They're doing all sorts of things. So that can be someone that's asymptomatic. And it's really hard to diagnose because you have people that, you know, are doing supremely well, and they have a lot of degenerative changes. And then you can have some people that aren't doing so well, but their back looks fine. So the big thing in terms of physio is that you're not really working on someone based on what their x-ray says. You kind of work with someone based on what they report to you and their function and how their daily life is. So that's really important. Yeah, so that's the first condition. So Dr. Ron was mentioning stenosis. Well, there's something in the chat here. Are there any exercises that a person can do to prevent this degenerative disease or alleviate some of the pain? Karen, that's a great question. I'm going to be getting to that towards the end of the presentation, but some of the stuff that people can do are some general mobilizations. I'll have some pictures of them. So mobilizations are just like small rhythmic movements that can get some increased range of motion. Because a lot of the time too is that when you have degenerative changes, you get really, really stiff. And because you get stiff, you have trouble moving. So what are the things that we do in physio is try and mobilize it and make you do some exercises to kind of help move your spine a little bit better. So if you've never heard of like the cat-cow, that's like a really good mobilization for your lumbar spine. I'll talk a little bit more about that later, but I think that's a good way to start answering some of your questions there. All right, so stenosis. Basically, how would I say this? So your spinal cord goes through the spinal canal. It's kind of like a big circle like this, and your spinal cord goes through, and then it branches out into different spinal nerves. And the spinal nerves can control your upper body or your lower body and stuff like that. Sometimes with stenosis, basically that means there's the space is closing in. So once big hole kind of starts to close in a little bit. And what that does is kind of, as you can see here, it's pinching on that yellow bit. So that's your nerve. And this can be really, really damaging and really, really painful for some people. Again, this is another illustration at the top here. So how does this develop? One way it can develop is just at birth. So if you have post-birth development changes, it can affect the narrowing of your spinal canal. And then the other thing is that if you have like surgery sometimes the unfortunate cases from some surgeries, trauma, whether it was like a motor vehicle accident or whatever, infection or tumors, those can reduce the size of your spinal canal, and that can pinch on the nerve. Now, what happens with that? So I mentioned it already. You can have some numbness and tingling down the leg. You can have some reduced motor function. So a really good example and a really big thing as to why this can be detrimental is that, let's say it's pressing on your L2 nerve. So that nerve controls your quadricep or your quad muscle. And if you're walking, all of a sudden your leg can kind of give away. And you don't want that when you're taking the stairs. You don't want that when you're walking, because that could really, you could fall, hurt yourself and things like that. So that's why it's important to kind of get to know what lumbar stenosis is about. The other symptoms is pain in your back and your glutes. It really is severe when you start to lose your bowel and bladder control or function. And that's where surgery might be in the play. So whenever stuff really, really starts to affect your function, and whenever you've tried all the medications and physio and all this other stuff, once that hasn't helped, then sometimes they start to try and think about surgery and things like that. So in clinic, there needs to be a number of tests before we can kind of say that someone has stenosis. One of the biggest things is you've got a lot of pain and extension. So if you're walking, and typically somehow someone that presents with very severe stenosis is bent over when they're walking the whole time. So they're kind of in a really flexed posture as they go about their day. And it's because flexion kind of relieves some of their symptoms in the back. Any extension causes a lot of pain, but flexion kind of relieves it. So that's one test to kind of figure out stenosis and things like that. Any questions on that? Okay, so we've talked about degenerative changes and we've talked about stenosis. The next thing that we're going to talk about is discogenic pain. So this is kind of a bird's eye view of what the spine is. I hope people can see my mouse. So this fibrous region is called the annulus fibrosus. I lost my train of thought there. And it's covering this gel-like substance called your nucleus pulpus. So with discogenic pain, this gel tends to protrude and come out on the spinal nerve. So basically that's what happens when you have discogenic pain. It's a protrusion of the nucleus pulpus on the annulus fibrosus. So basically the gel is popping out of the shell. Why this is bad is because, again, if you irritate that nerve, you can cause a lot of pain, you can cause a lot of motor dysfunction, you can cause a lot of sensory dysfunction, and weakness in your leg as well. This one, when I think there was a question about herniated disc, so that's kind of the other same sort of term, herniated disc. If someone blew up their back, you'll hear someone to say that. And usually the mechanism of injury for this is the flexion and the rotation. So if you're picking up something that was overly heavy, sometimes I've heard people just in the morning trying to put their shoe on and their back is giving out on them. So typically those are the signs that you might have had some issues with your disc. So we talked about how stenosis extension is a big problem. With lumbar discogenic pain, flexion is a big problem. So a lot of the times, one of the things that people do to kind of relieve themselves is to lay on their stomach and push their chest up because they're in extension. And the theory is that some of these gel-like substances will go back into the middle, and it will relieve the symptoms on the nerve. If it's really, really bad and it's really disrupting your function and you can't really go about your activities of daily living, some people will have a discectomy, so where they take some of this material out so it's not pressing on the nerve as much. So that's basically how we can get discogenic pain. So really it's that flexion and rotation. Sometimes it's repetitive, or sometimes it's that one big movement that messes everything up. Moving right along. All right, so I wanted to take some time and talk about kind of chronic low back pain. First of all, does anyone know what that is? Or do you recognize that? Is that something you've experienced? You can put it in the chat box if you need to. Okay. So basically with chronic low back pain, this slide is just to illustrate that there's a whole host of factors that can affect your pain. It's not only just what you see on your x-ray. We can start talking about first some psychological factors. So people that are suffering from depression, people that catastrophize pain, people that have passive coping strategies, fear avoidance beliefs, that can affect your perception of your pain and can actually increase your pain. So let me talk about one thing. So someone that's, let's say they have a history of back pain and they've relieved themselves, and then they do some sort of movement that they're like, oh no, oh my goodness, this back pain might be coming up and stuff like that. What happens is that your body starts to kind of pre-act and send your pain signals down towards your spine and causes an increase in your pain. There's a question here. Lumbar discogenic pain. Is lumbar discogenic pain or spinal stenosis common among people of African descent? That's a great question. I don't know the answer to that. I'll have to figure that out. But I know just as there's some healthcare inequities for people of African descent, there's also some data that suggests that people of African descent suffer back pain more than others, and that's for a whole host of things, whether it's social issues, or not being believed by their physios and things like that, and some genetic things as well. I know there's some evidence around that, but I don't know the full answer to that, and I'll have to get back to you on that. So going back to some of the other factors that affect chronic low back pain. So obesity, your demographic, physical activity level. So if you have a lot of weight in your stomach region and you're someone that suffers from like stenosis, if you have a lot of weight in your stomach region, your body goes into an extension. And if you remember what I said, that extension is really the main aggravation for stenosis. So if you're having that weight in that region, that can cause increased amount of pain. Sometimes people have nerves that are hypersensitive to pain. So that's kind of like a genetic thing. So that means that if someone was to get the same injury, let's say they both fell and bumped their knee. Two people fell, bumped their knee, the same amount of pain, same amount of area. One person that has the increased pain sensitivity is more likely to have more pain trouble than someone with decreased pain sensitivities. And then some other factors like smoking, alcohol consumption, your occupation, and socioeconomic status can also affect you and your back pain. So obviously occupations are a really big one. So if you have a job where you're doing a lot of repetitive motions, or if you have a job where you're sitting for most of the time, you're more likely to have back pain than someone that has a job that they're walking, getting up and sitting, getting up, moving around and stuff like that. So again, this is just to show that back pain is more than just, oh, my x-ray says I have degenerative changes. You've got to look at the whole picture. And that's what, if you go to a physio, they should be kind of talking to you about your history, how you injured yourself, where have you had a history of back pain, what's your occupation, are you a smoker, what's the severity of your pain, lots of things. They'll go through that whole kind of assessment before they make some conclusions about how they can help you. So let's see here, moving on. Okay, some treatment. So physio obviously is a really good start for back issues. And when you go to physio, some of the things that you might have done is to strengthen your core muscles. So I should have had a picture about this, but I didn't. You have like 4 different muscles around your core. So your core is kind of like your stomach region. You have your abs. You have a thing that wraps around your stomach called your transverse abdominis. It's kind of like a belt that goes around your spine. You have your pelvic floor, you have your glutes, so your bum, and then some back muscles. So all those muscles kind of work together as your core. And what your core does is kind of help you strengthen, it stabilizes your spine. So basically it allows you to do your activities of daily living at a better rate than if you weren't strengthening those muscles. Because if you don't strengthen, you become weak, and then your spine has to take the load in terms of doing some movements. And if your spine is taking all of that load, then it's more likely to have like a discogenic pain or just general degenerative changes. We don't want the spine to take all of the load. We want to strengthen the muscles around it so that it's able to kind of alleviate some of that. I talked about mobilizing already. So mobilizing is just like small rhythmic movements. So even me sitting in this chair now, if I bring my back up and down and up and down, that's kind of like a small mobilization. So what that does is kind of increase your range of motion, prevents stiffness, and kind of improves your flexibility a little bit. Stretching and myofascial work. So another thing about stretching and myofascial work is that a lot of the general problems with some backs is that typically people have like really tight muscles. So after you have, like, let's say if you've been involved in a motor vehicle accident, your muscles, you don't feel anything the first 1 to 2 days, but then after you get like serious pain, part of that is the muscles being super tight, super tense, and they're trying to protect the spine, but they're doing it too much. And some of the work that we try to do in physio is stretch and do some like myofascial work where you're pressing on the muscles a little bit and stuff like that. This is where you hear about foam rolling and stuff. And that's to try and alleviate some of that tension to kind of help reduce some of the back pain. So there's a couple questions here. I'm going to stop and look in this. So can you repeat those 4 muscles again that help strengthen your spine? Okay, thanks, Marcia. So the core muscles would be your abs, your transversus abdominis. I'm sorry I didn't put this there, but transversus abdominis, that's a belt that goes around your spine, your glutes, and your pelvic floor. Okay, I could spend like an hour in talking about all of those different muscles in particular. One strengthening or core strengthening exercise that I'm sure all of you guys are aware of is the plank. So that's when you're on your elbows and you're trying to stand or lay down, and that kind of works all of those muscles. Yeah, that's a good example of stretching the core. So your glutes, your back muscles, the pelvic floor, and transversus abdominis. Education. So education is like super, super important in physio. It's probably the biggest thing. So I talked about how, when someone comes in and discusses their issues and how they got their pain, you have to really sit down and talk and go from A to Z about where they got their pain, how did they do it, like who, how severe is it, when does it hurt, how do you feel in the morning compared to the nighttime, all those things, so you can get a better sense of how you can help them. And in terms of, like, for instance, I'll give you an example. So some people tend to get a lot of back pain while sitting in their car. Sometimes it's because their back is like super, super rounded. So I educated one patient and told him, just put a pillow on your back or put a towel on your back, and that towel will help them go into a more straighter posture or neutral posture instead of it being rounded. And that was the only thing I told him to do, and it alleviated the back pain. So it's really important to kind of listen to the patients and what they have to say so you can get a better sense of how you can help them. In terms of medications, so I don't know too much about that, but anti-inflammatories are, so your NSAIDs and stuff, those are typically medications that people use to relieve themselves temporarily. That's a big point. You're only kind of putting a Band-Aid to the solution. You're not really solving the whole problem. Really, strengthening and movement is solving the problem. And then surgery, but surgery is only indicated when people's function are severely impacted. So basically you can't do anything. You're getting pain with everything that you do at home. You can't, everything's like really, really difficult. So that's when surgery gets indicated. So the big thing with this is that prevention is key. So you want to move more and move often. So it doesn't necessarily mean that you're doing exercises and stuff. It means, you're going for walks. It means you're taking breaks from work. You're stretching as you take a break from work. You're taking the stairs. If you take the bus, take the stop before to go to your next stop. It's trying to figure out where in your life you can move more. So that's the big important thing, is that prevention is key. You want to move more and you want to move often. Okay. Can you show where you could place the towel when driving to help with back pain? So the towel is only indicated for someone that has back pain with a rounded spine. So you would, I don't know if you can see me here. I can't really see myself here, but kind of around this region is where you would put the towel, but it's really only indicated if your spine is rounded. If it's not rounded, then you might not need to put a towel when you're driving. So it's kind of important that you sit down with the physio and they go through that process with you, because everything is a little bit different. Okay, so you can put in the chat box or or mention it here. I just looking to hear your thoughts on what you think physical activity is, and what do you think these people are doing here? What types of physical activity are they doing?
Well, there's an aerobic.
Aerobic, yeah. So the guy on the left. Anything else?
Strength training.
Any non-doctors want to say anything?
Sorry. I'll shut.
Well, what do you think
Jogging,
about
stretching.
what do you
There
think
we
about
go.
those guys doing the CrossFit?
Yeah, so this is just to show physical activity. Okay, so physical activity is basically anything that gets your body moving. Okay. I can't hear you. Sorry, what's that? Okay, I'll keep going. Oh, someone's in the CrossFit, good or bad? That's a great question. CrossFit is inherently good. CrossFit gets a very bad reputation. So for those that don't know what CrossFit is, it's people that, kind of, well, the general idea is that people are picking up a lot of weights and doing very like full body motions. So people do like cleans and snatches, and so it's really like quick full body motions, and it gets a bad picture. But CrossFit is not bad. It's quite good actually, but you need to be doing it in the right form, and you need to be doing it with the proper weight, because if you aren't doing it with the right form and weight, that's when you can get into some serious issues. Okay, chat. Deadlift, good or bad? Again, same sort of thing. Deadlift is a really good exercise. Maybe one of these days we'll do stuff where I can show different exercises and stuff like that. But deadlift is a great posterior chain exercise, so good for your back, good for your glutes. It's a very good full body exercise. But again, you need to be able to do it correctly. If you're not doing it correctly, you can really hurt yourself. And some people that like to go into the gym and think they're all that and stuff, pick up really heavy weights and trying to impress somebody, and then they end up hurting their back, and they come to see me. So you don't want to be that. So yeah, we just talked a little bit about physical activity. So there's the cardio, which is this guy, the strength, and then the flexibility. So these are all different types of physical activity, and it can be all interchangeable. So yoga is mostly considered flexibility, but you can get some cardiovascular benefits from that too. And with cardio or aerobic exercise, basically it's anything that increases your heart rate. So running, walking, swimming, biking, all that stuff kind of classifies as aerobic or cardio. Strengthening, so weightlifting, doing body weight exercises, attending the Men's Health League exercise video class, all that stuff counts as strengthening. And then yoga or flexibility, it would be like yoga, chair yoga, Pilates-ish, Tai Chi is kind of good for flexibility and stuff as well too. So these are all different types of physical activities. And it's moving on here. So here's some of the benefits of physical activity. So firstly, Canada recommends that you get about 150 minutes of moderate to vigorous activity per week in at least 10-minute segments or more. So this might seem daunting for some people, but we know that even if you're getting like 60 minutes of exercise per week, that's really beneficial as well. And some of the benefits of doing 150 minutes of moderate to vigorous activity is that, you have a 20 to 35% reduction in mortality or death rates, 50% reduction in cardiovascular risk, 21% reduction in cancer-related mortality. It's very protective against type 2 diabetes, reduction in osteoporosis, reduces stress and anxiety and depression, and then increases cognitive effects. This is all done from exercise. So exercise is really the best pill, the best medicine there is in the world, in my opinion. And my opinion is very biased because I'm a physio. Mario, I heard you talking about the Men's Health League workout class. Can you talk about that? Is it only for men? No, it's not only for men. It's for everybody. We've been doing Men's Health League online classes by me, and my sister has been helping me as well. And they're recorded and left on the Men's Health League Facebook page if anyone wants to do a quick little workout. Yeah. I think I have a video here, so I might have to exit this really quickly. Let's see how this works. If we can't, if this doesn't work, then unfortunately we'll just have to figure out another time. Okay.
Hi, I'm Dr. Mike Evans, and I'm presenting this visual lecture called...
Can anyone hear that so far? Yes? No? Maybe so?
Yep.
Can hear it, can't see it.
Oh, can't see it. Okay, hold on. Let's see. What can we do here?
23.5 hours.
I can hear it a little bit.
Okay, let's see here. Oh. Hold on. Here, I'm going to just stop the sharing for a second. Share screen. There we go. Try that.
Partnership with 24-Hour Fitness.
How's that? Okay, let's play the video.
It's great to be working with people who are passionate for helping others achieve their individual fitness goals and promoting positive change in their lives. So I have a big interest in preventive medicine, which can mean a lot of things from, cancer screening to eating more fiber to having a good social network. And I mean that in the old sense of the word. Weighing less, drinking less, smoking less, controlling your blood pressure, cholesterol, and so on and so forth. So all these things are incredibly important, and I wouldn't want you to minimize your efforts in any one category. But I want to know what comes first. What has the biggest impact? What has the biggest return on investment? What makes the biggest difference to your health? So I did my research, and I found an answer, at least for me, and it's tricky because, all these things are sort of overlapping. But I picked out this intervention, and because of its breadth, it worked for so many different health problems, and that's what I found so cool about it. So just to kind of walk you through a quick list. So this intervention in patients with knee arthritis who receive 1 hour of treatment 3 times a week reduced their rates of pain and disability by 47%. In older patients, it reduced progression to dementia and Alzheimer's by around 50%. For patients at high risk of diabetes and coupled with other lifestyle interventions, it reduced progression to frank diabetes by 58%. Following over 10,000 Harvard alumni for over 12 years, those that had the intervention had a 23% lower risk of death than those who didn't get the treatment. It's the #1 treatment of fatigue, and of course, the kind of outcome of choice there, my favorite outcome is quality of life, which is really all of the above and about making your life better. And this treatment has been shown over and over again to improve quality of life. So the question is, what's the medicine, and what is 23.5 hours? So the medicine was exercise, mostly walking, so not triathlons. And let me just put it a different way. I think what I'm asking you to do is, if you think about your typical day, so there's 24 hours, and so you might spend most of your day, this varies obviously, but couch surfing, sitting at work, obviously sleeping. The evidence that I'm going to show you kind of tells me is the best thing you can do for your health is to spend half an hour being active, maybe an hour, and that if you can do that, you can realize all the benefits I've described in the previous slides. So if exercise is a medicine, what's a dose? So when I think of dose, I think of how long, how often, and how intense. I'm going to give you a slightly mixed message, but essentially more activity is better. But I must say the rate of return seems to decline after 20 or 30 minutes a day. So if you're being active less than 150 minutes a week, or more if you're a kid, an hour a day if you're a kid. My flag goes up in the clinic. So my personal take on this is that the literature draws a very broad brush, and so we see big differences when somebody goes from not doing anything to doing something, and after that, the return is more granular. So if we took the Nurses' Health Study, women who went from zero activity to just 1 hour a week reduced their heart disease rates by almost half. So you can break it down, so it can be 10 minutes, 10 minutes, 10 minutes if you want to do 30 minutes of exercise, so it can be broken into 3. If you're only going to do it if it's pre-booked with friends, I have couples that take a half-hour walk every morning or evening to organize their life. A dog is a great walking coach. The data is showing 67% of dog walkers achieve 150 minutes a week just with the dog walking. And finally, of course, your commute, getting off stop early, taking the stairs, and so on and so forth. The next way to think about it is the reverse. So what I call sitting disease. We know that being sedentary is bad for your health, but a researcher named Leonard Veerman wanted to quantify this, and he did so down in Australia in a big study they did there. They found, compared with persons who watch no TV, those who spend a lifetime average of 6 hours a day watching TV can expect to live about 5 years left. I mean, that's incredible. But then I think, who watches 6 hours a day of TV? And it turns out the average adult in the USA spends about 5 hours a day watching TV or screens. So I find this fascinating that we never think of the TV as something that's bad for our health, but clearly it's as powerful as many other risk factors for chronic disease. So I'm going to finish by asking you a question. And this may have some personal challenges for you. So, you might be very busy with work or kids or both, and you may be in pain or have other priorities. But question to you is, can you limit your sitting and sleeping to just 23 and a half hours a day? So whether it's hitting the gym and attaining fitness goals or walking the dog or taking the stairs, get out there and be active. Thanks again to 24-Hour Fitness for bringing you this.
All right, cool. Stop share there really quickly and go back to my PowerPoints. 1 second. Okay, and share screen. And back to PowerPoints. Okay, good. So what are you guys' thoughts on that video? You can put it in the chat box or speak up, whatever you'd like to do.
Speak up. No, it's good. Very powerful medicine.
Yeah, awesome. Yeah, love that video. Thanks for sharing. I've not seen that in a few years. Yeah, it's a really, really great video. It just goes to show the benefit of moving more and being exercise and all that stuff. All right, so we're almost done. So I just wanted to talk about exercise safety. So if you are exercising, things that you need to consider is that make sure that you stop exercising if you're experiencing chest pain, shortness of breath, severe ankle swelling, dizziness, blackouts. And these are the pictures I have here are kind of two.
Men's one.
The first thing here is called your RPE. It's called rate of perceived exertion. It's a way to kind of test how tough an exercise is or how well you're doing and things like that. So basically, if you're at a 10, that means that the exercise is really impossible. Like you're breathing really, really hard, like you want to pass out. So you shouldn't be at a 10 for exercise. If you're at a 1, that means that you're not really doing too much. It's a breeze, no issues. So if you want to get the recommendations are moderate to vigorous. So you want to be at a 4 to 7 range. Okay. So whenever you're trying to do your exercise, whether it's walking, whether it's weights, you kind of want to be at a 4 to 7 range. So that means that you're kind of breathing a little bit heavily. You can hold a conversation. It's comfortable, but a little bit challenging. So that's the level where you want to be at to get like the moderate to vigorous health benefits. However, if you're still at a 2 or 3 or 1, it's okay. As long as you're moving, is really important to kind of keep moving. Any questions on that? Okay. And then the last thing here is just goal setting. So whenever you are starting to do any exercise or anything in life, you want to kind of make some goals. I'm sure lots of you have seen this before. So this is the SMART goal acronym. So S stands for specific, M is measurable, A is attainable, R is realistic, and T is timely. So specific is just making the goal small enough that you can, it's not overly large. So it's not like I want to lose weight or I want to be physically active. You need to be a little bit more detailed than that. Measurable is putting a number to it. So it's how many times a day, whether it's 2, 3, 4. Attainable and realistic are kind of based on you. So do you think you're 70% confident you can make this goal, or do you think it's a realistic goal? And then timely is just putting a time frame to when you want to do that goal. So I put an example there. I'm going to watch one of the Men's Health League exercise videos twice a week for 3 months. So that's a specific goal. That's it's a measurable goal. There's a number to it, and it's timely over the 3 months. I think that is it. So
Question.
Yeah. Love that video. Just watch. Have not seen it. Just watch. I don't know what that means by just watch.
Now go ahead to ask the question.
He's doing something.
Nope, I'm good.
Yeah, he's good.
I think the video we just watched, Loretta's commentary was very good. There's a question here I put about acupuncture. What's your opinion?
Oh, my opinion on acupuncture. Acupuncture is, it's good. Sometimes it works for some people. It works. It doesn't work for some people. It's something that's not overly. There's not a lot of risk to it. So if you're at a physio clinic and you want to try it to try and help alleviate some of your symptoms, sure, you can do it. However, I will say that, and this is probably my bias, I think for any sort of injury, for any sort of condition, one of the things you need to be doing is moving some way, somehow, whether it's doing exercise or just doing minimal mobilizations. And acupuncture does help, but it's kind of like a passive treatment. It will help with some of your pain here and there, but over the long term, if you're just doing acupuncture, you might not get a whole set of benefits for that. Okay, what about dry needling? Marsha, that's another good question. Same sort of thing. So dry needling is basically, again, it's to deal with the muscle tone, muscle tensing. So whenever you have an injury, sometimes your muscles get really, really tight to kind of protect it. So dry needling, when you go into the muscle and poke the needle up and down and stuff like that, it makes your muscles kind of contract and relax. And it's, in theory, this is the theory, is that it's supposed to relax your muscles. So again, some people benefit from it, some people don't benefit from it. I will say it's another passive treatment. The biggest thing you need to do is to move more. Do you recommend something to wear on your foot at night for plantar fasciitis? Great question. I'm not 100% sure on that. What I will say is that when you're sleeping, your foot, so let's say this is my foot, okay? It's kind of like this. When you're sleeping, your foot's kind of like this. It's whether you're laying on your back or whatever. Sometimes, well, plantar fasciitis is the fascia, the thing at the bottom of your feet. It gets really tight and tense, and it can cause a lot of inflammation. So what I mean is that when you're sleeping, all those muscles or all those fibers get really short. So when you get out of bed and you immediately try and expand all those fibers, that's when it causes a lot of pain. So the one thing I will recommend is that before you get out of bed, just move your feet up and down, twirl them round and round, put them in circles and stuff before you hop up and go to the washroom or shower and have your day and whatever. But I'm not too familiar about shoes. I'll have to get you about. I'll have to.
Question is long.
What are your thoughts on stretching? Do you agree with it before or after running? Loretta, that's an awesome question. So what we used to think about was, so stretching can be kind of broken down into dynamic and static stretching. So static stretching is typically, you know, when you stand, so let's say I'm stretching my shoulder, I hold it in this position for a long time. That's the static stretch. A dynamic stretch is when I'm kind of moving my shoulder kind of up and down and stuff. Some research has come out and said that static stretching is not really, doesn't really do anything before a run, or there's some help after, but before it doesn't really do anything. What you need to be doing before the run is getting a proper warm up. So whether that's just minimal quick feet on the spots, jumping jacks, or just slight movements. We can get into that in a little more detail, but you need to be doing some sort of slight movement to get your blood pumping to your muscles and get your muscles relaxed or prepared for the exercise, rather than just doing static stretching. Afterwards, stretching can be fine. The reason why people stretch, again, is to kind of help get some range of motion. So if they're really stiff, stiffness can cause some pain and some issues, but if your stiffness is not causing any issues, you might not need to stretch at all. So just to answer your question, before exercise or before running, I wouldn't stretch. I'd probably just do a dynamic warm up, and it doesn't really matter if you stretch or not after your run, but if you want to, go ahead. How to access Men's Health exercise. How to access Men's Health League exercise program. That's on Facebook. Nova Scotia Men's Health League exercise. There's a bunch of videos that are already there, and you can just kind of go through. Again, go at your own pace. For some might be difficult, so just go at your own pace, and I think there's some modifications for that as well too. For the exercise program, leave your email in the chat and Dwayne will collect it.
I have a question.
Yeah, what's your question?
Yeah, I think when you started, you kind of mentioned something to do with exercise and nutrition, or physiotherapy and nutrition.
Ooh.
If you want to talk about nutrition, but secondly, does it matter if you have to eat before exercise or after, or is there a best time to exercise, morning or evening, or?
Those are good questions. So the first thing, exercise and nutrition, I'm not, I don't know too much about nutrition, honestly. So my knowledge on that is not great, but obviously the one thing I will say is that the new Canada's food guide is excellent. It's really good. It breaks it down really smoothly. And I think it's one of the better things that Canada has done in a long time in terms of food and nutrition. So follow the Canada's food guide, the new one. And then your second question, when you should eat before or after exercise, you want to kind of eat a couple hours before you do some exercise. Obviously, things happen and you might be in a rush and whatever. But if you eat, so when you eat, your food starts to go through its digestive system. You're getting a lot of blood that goes through your digestive system so that you can digest your food properly. And if you exercise right away, then your body's kind of like, whoa, I need to deal with the food rather than the exercise. So if you have a couple hours before you start to exercise, then your body can kind of deal with the two at separate occasions, if that makes sense. And yeah, that's how I'll answer those questions. Any other questions? Again, the biggest thing here is to move more, move often. Like the video said, however you can move in your daily life, just kind of move when you want. If there's no further questions, that's it for me. Thank you for having me today. I hope you learned something, and yeah, and maybe sometime we can talk about a more specific thing. This was meant to just be very general, but maybe we could talk about a more specific condition next time and stuff like that.
Just one sec here. So does anybody have more questions that they'd like to ask Korede at this point? Karen, I think you're on mute. Okay.
I just saying he's awesome. I put my comment in there. Thank you, Korede.
No problem.
All right. So Korede, thank you very much. That was a wonderful presentation. Thank you for taking the time to make it knowledgeable for us. And we look forward to talking to you again. Have a wonderful evening.
Okay. Thanks. Good job.
Excellent.
Bye. Bye, everybody.